My name is Jen Cortina, and I'm an RN here at IAA. I've been here for approximately a year and a half. I joined the team as a block nurse, which is unique to the institution.
Describe your role as a block nurse.
Basically what I do is I help get the equipment, and I assist the physicians, the anesthesiologists, with all the blocks for the day. It's a unique position here at St. Vincent's, and I assist the anesthesiologists on a day-to-day basis, administering the nerve blocks to patients to help with pain control. I also interview patients and I speak with them. I do lots of teaching so that they know what to expect before and after. I follow up with the patients as well with phone calls several days after their blocks just to check on them, see if they're having any difficulties, any questions. I monitor how long the block lasts for them so that we can keep statistics and follow up with pain control.
Can you describe the work environment at IAA?
It's an amazing group. All of us work together, and we cover for each other. I work at trying to make their lives, their days a little bit easier so that they can tend to the patients and administer the blocks. Everyone covers for each other. They're very good about answering questions, any questions that I have or anyone else has, as well as the nursing staff as well.
What led you to join IAA?
I've been approximately a year, just a little over a year. I came from a general surgeon's office, and I came here with my history of orthopedic experience, and it just happened to have this position available that kind of really fit with what I have done in the past. And although a lot of it was new to me as far as the anesthesia and the blocks go, the anesthesiologists and the CRNAs have been amazing with helping me along, learning and being able to assist them.
How do you manage such a unique position?
Well, I really am very organized, and I start my day very early. I try to plan as far ahead as I can in getting all the equipment ready and teaching the patients and getting in there early enough so that I can reach the patients before they even get into the room to speak with them and to actually give them the block. It's just a lot of organization, and that's it.
How do you manage work-life balance?
It's not easy. My mornings start really early, and I do tend to get home a little bit late at night, but I enjoy it, and that's what makes the difference. I really love my job. I love the anesthesiologists that I work with. They're a great group, and they treat me well, and I have no complaints.
What motivates you at work?
If I wasn't so passionate about the job, about the people that I work with, I wouldn't be able to continue at this pace, but they really inspire me to do my best and to really try hard and make things easier for them, because that's what I'm here for, essentially.
How do you maintain your level of purpose?
My job, again, is to make their lives easier, and I really try hard, and it does motivate me to work harder. I get here even earlier in the mornings when I know it's a busy day. But like I said, they inspire me to do my best. I love working with them. They're a great bunch of people.
Do you think the teamwork at IAA affects patient care?
It definitely does. I get a lot of positive feedback from patients that they appreciate that I can take the time to explain things to them. They also see me prior to the block, during the block, and after the block. When I see them after their surgery, I also follow up with phone calls. So they're well accustomed with who I am. They know who I am, and they feel comfortable with me, and I think that's invaluable.
How has IAA supported you along your career?
Well, when I first started, they introduced me to the entire staff. Everybody was very welcoming. They also sent me to a course in Florida that introduced me to the nerve blocks, and it was like 2 days of constant nerve blocks. So I really got the feel for what goes on, got a lot of ideas. I was able to bring back ideas along with a colleague to IAA and to St. Vincent's to better our program. To make things more functional, to make them run more smoothly.
What would be lost without a block nurse position?
I think you would lose that personal touch with the patients the most. Some of them do come in scared. Some of them know what, they've heard of blocks before, or they've had them, or know someone who's had them. But for those, especially those that have never had it, they're very nervous, very scared. It's kind of scary of thinking of someone sticking a needle into a body part. So I think you lose that personal touch, that educational point too, because there's not really enough time in the doctor's day or the CRNA's day to take the time and follow up and do the blocks and do the teaching, look up the patients. So I think that it's really important. This position is super important. I think it's vital, actually, to the success of the program.
What is most rewarding about your job?
At the end of the day, it's completing the blocks. It's getting through the day, and seeing the patients come out of surgery and they're really comfortable. Some go home. Others that are admitted to the floors, they're sitting up. They look fantastic. They tell me they have little to no pain, and that's most rewarding for me.